What is going on, everybody? 'Tis I, the enigma of the gun airwaves, Miyanovich, welcoming you to Season 3 of the Liberal Gun Owners Lens podcast, where unprecedented perspectives are packed into the cargo hold for the LGO Lens spaceship Voyagio.
That's fucking Italian.
Don't believe that evolution is possible with guns and public safety in America? It's already happening, y'all. Minds are evolving. Think guns versus public safety is the only game in town, do ya? Think culture war is the big boss, do ya? Then keep your ass in the past. Everyone else, all aboard! We're now getting to the main reason why I contacted you for the podcast in the first place. And that is very shortly after YouTube internet personality Paul Harrell passed away from pancreatic cancer. You stated in our comment section, which is why I noticed what you said, is that you are also in a similar situation. And I wanted to give you the podcast and the floor to talk about what's going on with you, to get any messages out there that you want to get out to anybody in the world, or your friends or your family, or anybody in guns, or anybody in the community, to give us some perspective, because you have something very serious going on with you. So can you let us all know what is going on with your health currently?
Absolutely. And I appreciate the support here. So I have stage 4 lung cancer, and I have had that for almost 3 years now, which is well past the average survivability of stage 4 lung cancer. And my particular lung cancer is what is called a well-known mutation. Specifically, it is a EGFR exon 19 deletion. So EGFR is epidermal growth factor receptor, and exon 19, EXON, refers to a portion of the genome sequencing, a very specific set that has been removed from the DNA sequence in my cancer, and that's what allows it to spread. So one thing I want to make sure everyone knows is November is Lung Cancer Awareness Month, and lung cancer is the white ribbon, although, of course, there's no official, cancer colors. Some people disagree on the colors, but that's the generally accepted one. So I'll tell you a little bit about how I found out I had lung cancer.
Okay.
So my best friend and I had some land in rural Montana, and we were up there doing some things, and I found myself just getting terribly winded. I would pick up, maybe 10 pounds of firewood, and then I'd huff and puff and need to recover for a minute or two. Something was clearly wrong. And when we were coming back from one of those trips, I couldn't make it through the Salt Lake City airport. I had to actually sit down after, trying to walk for 10 minutes. Yeah. And that's not typical for me, right? I've been a frequent flyer for most of my life. I've been through that airport. I don't think I've ran in that airport, although many of them I have. And so something was wrong. So another thing that I had noticed is my resting heart rate was over 100. So clearly something's wrong. Yeah. So I go to my PCP, and he does his things and says, sounds like it might be the heart. Let's put a Holter monitor on you. And if you're not aware what a Holter monitor is, that's something that's a little band or a sticky thing that they put to just kind of listen to your heart over a period of time. Yeah. So what we wanted to see is this related to waking up? Is this related to any of my activities? And so I had to make a little journal. Nothing conclusive from that. And that was probably May, June, July of 2021.
Okay.
So fast forward, and I'm still dealing with this, but it's manageable. And I was like, okay, maybe it was because I was at elevation in Montana that was the issue. Maybe that's what it was. And then very distinctly, I remember this, for Thanksgiving of 2021, I barely ate. And that is one of my favorite meals of the year. I look forward to it every year. I cook it. I love doing it. I've done a bird 8 different ways. Stuffing is like I will gain weight just eating stuffing, right? I love my Thanksgiving dinner. Yeah. I barely touched what was on the plate. My wife and my son were like, something's wrong. She wasn't my wife at the time. She was my fiance. Then the Friday after Thanksgiving, I went to get a massage. And I've used massage therapy over the years, and it's always been very beneficial. and the massage hurt. So, okay, something's really wrong now. And then that night, I woke up at 2 a.m. and told my wife I couldn't breathe. So needless to say, the next day I went to urgent care, and the poor physician's assistant said, I don't hear breath sounds in your right lung. So at that point, there's a lot of things that could be, none of them are good.
Yeah.
So we wanted to go get imaging, but because this was still COVID staffing issues, they didn't have someone to do the chest x-ray at that location. So what they did is they pulled some blood to check for clotting factor. They were worried that I might have thrown a DVT, a deep vein thrombosis. Mm-hmm. They were worried I had a clot blocking my lung, and that would be, life-threatening. So they did that. The test came back negative, and they said, go to the ER. So drove myself to the ER, probably dinner time, and they quickly got me for a chest x-ray, and it was awful. My right lung basically didn't exist anymore. We eventually found out 7.2 liters of fluid in my pleural space. That's the cavity in which the lung exists.
Yeah.
My heart was shifted 2.5 centimeters. My esophagus was shifted. All of my organs were being pushed. I had fluid on the heart, fluid on the liver. These are known as ascites. Mm-hmm. And I was in a very bad way. Yeah. And I became the talk of the emergency department because not only had I driven myself there, not only had I walked into the ER, I had done 2 hours at Topgolf the day before. So they're like, how the hell are you doing this? So that was the only, positive part of that experience. COVID was still going on. They didn't have a lot of beds, and they weren't able to get me into a surgical theater to put in the chest tube. So my pulmonologist, Dr. Bohr, basically MacGyvered it and put it in the emergency room bay, yeah, which is not what they normally like to do. So I had a tube sticking out of my right side, and it hurt like hell. And we took 4 or 5 days to get the fluid drained off of it. At that point, the pulmonologist said it could be a number of things. It could be a malignancy, which means cancer. It could be a bacterial infection. It could be a viral infection. And he just kind of drained the list. And again, kind of like the urgent care, none of them were good.
Yeah.
So it's actually some ways fortunate that it is a cancer because we know how to treat that. But anywho, so I got the official diagnosis on December 1st of 2021. We pulled the fluid, and this is something really cool that's kind of science fiction. They actually sequenced the cancer DNA. So not my DNA, the DNA of the tumor.
Oh, interesting.
And they can do that from liquid. They can do it from the pleural effusion, that is to say liquid in the pleural space, which again is the cavity in which the lung exists. They can also do it from blood, and it's really cool. They call them liquid biopsies.
Okay.
So we did the biopsy. We had done the cytology earlier to know it was cancer of some kind. So we knew it was a cancer of some type, and then we did a tumor sequencing from the liquid biopsy, and it came back with that EGFR exon 19 deletion. And what that meant for my treatment was I don't start chemo. I don't do immunotherapy. I take a pill a day. That pill is called Tagrisso. The generic name is osimertinib. It is a 3rd or 4th, depending on how you want to count it, generation TKI, tyrosine kinase inhibitor. And that took care of my cancer. I didn't have to do chemo. I didn't have to do any of those horrible things. So I stayed stable for 2 years, a little over, about 2.5 years. And then this spring, I developed some pleural effusion on my healthy left lung. And that's where we discovered my second mutation, because I'm such a lucky guy. I got 2 different kinds of cancer. And that is called an MKRN1 BRAF fusion. So an MKRN1 BRAF fusion. And like my exon 19 was a deletion of a little portion of the sequencing, a fusion is where part of one and part of another of the DNA sequence merged in an unexpected way.
Okay.
So needless to say, even though I'm in IT, I've done a lot of research on what these things mean. And I've seen the actual DNA sequencing, and it's really cool. It's little lines on a pink background, and you can clearly see the difference where this one's blank or these two came together. It's actually really fascinating.
Yeah.
But we tried some drugs that target BRAF mutations. They didn't work for me, and I started chemotherapy. And I was terrified to start chemo right? I'm a kid of the 80s and 90s. I remember watching ER, and chemo was last resort. I was going to lose my hair, right? And I was going to be dead in 6 months anyway, so why bother, right? That's the perception I had of chemo. And a lot of people that get new lung cancer diagnoses, that is their perception of chemo as well, right? We just have this stigma around it. So the chemotherapy I did was a combination of carboplatin, which is a platinum-based chemo, and pemetrexed. It's the generic name for the brand Alimta, which is a kind of supporting, kind of an immunotherapy, but not exactly chemotherapy. So rough, I basically the way I can describe it is you feel like you've got the flu and a hangover at the same time, and your appetite goes to shit. I lost probably 40 pounds doing chemo, and it was rough. But after 3 rounds of that combination chemotherapy, and they were every 3 weeks, so after about 2 months, the pleural effusion on my left lung had completely dried up. The drain that I had in there, I had a semi-permanent drain called a Pleurex that we were draining daily at home, and it dried up. So chemo did exactly what it was supposed to do. I did 4 rounds of that. My blood cell counts tanked, and I was immunosuppressed and all the things. So we dropped the platinum-based chemo, and now I just do what we call maintenance chemo, and that is done every 3 weeks, and that is just the pemetrexed. That one's, not a walk in the park, but it's so much better. I generally take a half day to do the chemo on Monday, and I don't have to take any other time off work.
Yeah.
And that's where I've been I did my 10th round of chemo. So I've done 6 rounds or 18 weeks of the maintenance chemo, and I'm still stable. So the way I describe it is we're in the realm of science fiction with some of these drugs.
Yeah.
And the amount of research that's being done on my specific mutations, there are drugs on the horizon that could potentially change this from being a terminal illness into, a chronic disease. There are trials for lung cancer vaccines happening right now. We have the next generation of TKI drugs available. We're testing novel immunotherapies. There's just a lot coming. And what I like to say is that I'm riding the bow wave of medicine. So if you imagine, surfing, you want to get on the top of that wave and just kind of ride it till you get to the next one.
Yeah.
And that's where I'm at. If I can last another couple of years, I'll have access to the next drug. And then if I can last a couple of years on that, I'll get to the next one. And by then, or maybe the one after that, I do think we will have something in the same way that we can now truly treat HIV.
Yeah.
We're on the cusp of that for not just lung cancer, but a lot of them.
How fast? So let's talk about the first bout of cancer that you had on the one side where you realized that you had the issue. How long do you think that was manifesting itself over there? Do you think it was just like, boom, it started, and then in 6 months you were in deep trouble? Or do you think it was like slowly happening over a period of years?
It's a great question, and that's one that I have no answer to. There's unfortunately no way to know when it started because I don't have a history of chest x-rays or other imaging that would have shown that.
Right.
So pleural effusion will show up on an x-ray as a void, right? The lung tissue shows up, but if there's pleural effusion that separates the lung tissue from the pleural wall, that shows up, bright lights, shining lights as a problem. So my first chest x-ray was after I'd experienced all the symptoms.
Yeah.
If I look back at what my symptoms were, I had started getting a little shorter of breath and having a little bit of a pulse issue prior to it getting bad, but it wasn't a long time.
Yeah.
And like I said, it was just very obvious on that trip in Montana. So yeah, I probably could have found it a little earlier. Unfortunately, unlike prostate cancer or even colon cancer, where you can get blood tests and other things like the PSA antigen for prostate, there's no blood test for lung cancer.
Yeah.
And you generally don't want to screen by taking every adult in the US to get a chest x-ray once a year, right? There's downsides to doing that.
Okay.
And so I just don't have the timeline. I don't think it was years. I do think it was months. And I think it was a relatively short amount of months. And the reason I say that is lung cancer and adenocarcinoma being the specific diagnosis tend to be aggressive.
Yeah.
And so it's very possible that this started and became metastatic. That is to say that I had metastases or additional areas of cancer beyond the tumor. So I had metastases all throughout my skeletal system. It probably happened fairly quickly. And luckily, it also responded very quickly.
Right.
So by the time I had my first CT after my diagnosis, all of my metastases had healed, which is just freaking amazing.
Yeah, that sounds amazing. When you had your first chest x-ray and showed one side was bad, one side was good, then you took care of the bad side, then the other side gets bad. So how long is it until from that first chest x-ray to the second side getting bad? How long was that period of time?
Yeah. I'd said 2.5 years. I'm actually wrong. It was about 2 years and 3 months.
Okay.
So I started the Tagrisso in December of 2021, and that was my only treatment until February or March of this year. And so that's when we discovered that there was something going on with the, quote, healthy, end quote, lung.
Yeah. Is there any stuff going on in your family in terms of genetics or family history that would make you be susceptible?
Great question. So let me talk a little bit about exon 19 and in general EGFR cancers.
Okay.
So the average lung cancer patient is in their 60s and a smoker, right? That's the stereotype everyone has of lung cancer patients.
Yeah.
I'm a never smoker. That's the category we use. Non-smoker, never smoker. There's a subtle difference because there are people who are non-smokers but used to be smokers.
Sure.
So the exon 19 deletion, the average, and I got to put this in air quotes because it's hard to really do averages, but is a woman below 40 in Asia. That's where you tend to see these. As best as all the researchers have been able to tell, there is no genetic component to exon 19 deletion.
Okay.
We generally believe it's environmental, but we don't know what. So common things that can cause lung cancer beyond smoking, radon gas. So if you live, and not just in an area with a basement, even slabs in parts of Texas can get radon. Get a radon detector. It's a very inexpensive device, and it just protects you because radon is bad for so many things, especially growing children, but it is a cause of lung cancer. Beyond that, I've been to India 12, 15 times in my life. Obviously, there's more air pollution, particularly in the city of Delhi, which I've been to 3 or 4 times. Mm-hmm. Maybe that's part of it, but we don't know. Yeah. Both my parents smoked, so maybe I got some secondhand exposure, but again, there's no correlation to that.
Sure.
So as of right now, we're not really sure how this exon 19 deletion happens in patients.
Did you get more hyper aware of your current environment because of the cancer? Did you look through your current environment and be like, okay, there are maybe exposures that I'm having right now at home or at the workplace that I need to think about and I need to clean the situation up or not expose myself? Is that did you have that kind of a mindset?
No, I really didn't.
Okay.
Part of that is in basically Thanksgiving of 2020, I had moved into my new house, my home that I had built up here. So I knew that, I had the radon mitigation system and it was tested and all of those things. Plus I've got HEPA air filters on my air systems. Like I knew the house was good. So I wasn't considered there. I will say I'm a little more vigilant about, 2 things. I'm vigilant about wearing a mask when I travel, right? I had been traveling in Southeast Asia well before COVID and already had that mindset of if you're sick, you wear a mask. It's just generally polite. Yeah. So I just extended that post-COVID. And even now, when either myself or my wife travels individually or together, we always wear a mask until we're in our seats. I don't want to risk anything else. COVID is bad enough on its own, doing it on one lung or RSV or influenza or just the common cold. One lung is kind of a disadvantage for most things.
Yeah.
So I do have that level of kind of diligence. And I do think about, when I traveled to India, I did wear a mask outside, specifically not a full respirator, but a good N95 mask just to avoid some of the pollutants. But beyond that, I didn't do a lot of, worrying about where it came from or should I do something to prevent it. I kind of have practiced the radical acceptance of it is a thing that happened and I just have to move forward now.
Yeah. Did you get COVID? Have you had COVID since all of this
No,
stuff?
I'm very fortunate. I have not, myself and my wife have never gotten COVID. My child actually has been exposed to COVID 2 or 3 times and never gotten it. We all are vaccinated, as you would expect, and do the boosters. Because of my cancer, I did get some additional vaccines. So I have the pneumonia vaccine, which is not typical for my age. And I also got something else, I'm blanking. But I've always been pro-vaccine. During my trips to India, I've gotten a rabies vaccine because I went to very small towns in India for weddings. I got my Japanese encephalitis vaccine. If y'all don't know, when you go to India, you need to get a polio update. And it's actually really cool. You get the live virus polio, and it's in this, international drug box, and it has a picture of a virus, and the thermometer is red, and he's sweating and like scary face. And then another one where there's like a scarf around him, and the thermometer is blue, and it's got the shivering motions. And I thought that's really cute that I've got a virus in my fridge, and I've got to think about it as some anthropomorphic thing. It was really funny.
Did you self-administer that one? If it's in your
that
fridge?
one is an oral vaccine.
Okay.
So there's 2 kinds of polio vaccines. One of them is inactivated and it's injected, and the other is active and it's oral. That's OPV. Okay. And that's just because polio does still exist in India. Yeah. And yes, most Americans got that as a kid, but 20, 30, 40 years later, it's a good idea to get the booster. It's part of the CDC guidance when you travel to India.
In terms of like lung capacity, lung ability, what's the lung capacity or your lung ability in both lungs?
So that's a good question, actually. So we tested that after I had gotten the Tagrisso on board, and we kind of figured that the cancer was stable. So I went and did a pulmonary function test, and I had done one, I don't know, a couple of years prior, because I had some asthma, allergic bronchitis, reactive airway syndrome, something in the family. So we wanted to test it and see, how well I responded to inhalers. And my lung function prior to the cancer was about 97% of expected. So pretty good. With one lung down, so my right lung at that point in time did nothing. It was completely collapsed. No air was making it past basically the bronchioles. Mm-hmm. I was at about 60% lung capacity. And I'm actually really fortunate that I'm tall, because that elongates the pleural cavity and makes more room for the lobes of the lung. An interesting fact not everyone knows is you have 3 lobes on the right, 2 on the left, because the heart takes up a little bit of space. So on 2 of 5 lobes, I'm at about 60%. So I'm doing really well in that regard. Unfortunately, it meant I couldn't get my allergy shots anymore, because you have to have a high enough lung function because they're worried about anaphylaxis. Yeah. What's really fascinating is the Tagrisso has helped my allergies. So epidermal growth factor receptor, what does epidermal mean? Well, think of this cells in your skin, the cells in your nose, all the fast growing cells in your body. Well, if you kind of suppress epidermal cells a little bit, you get really interesting things. So my nose, I don't get nasal congestion the way I used to. My allergies are basically gone. It's really paradoxically kind of interesting.
What in the right, would you say the right lung, that's the original problematic side, yes, it's worse than the left side, even though you explained to us the 3 lobes and the 2 lobes? Would you say your right side is kind of generally not very good in the left?
So my right lung is effectively non-functional.
Okay, still.
Yeah. So okay. I'll elaborate on that a little. So when I did the chemotherapy, we actually had an unexpected benefit of that, where my right lung started to inflate a little bit. And it has inflated a little bit more every round of chemo, even the maintenance chemo. We estimate that it's probably at 10% of its capacity. Okay. It's not really helping my oxygenation. We never expected that lung to reinflate, right? It was what's called a hydropneumothorax, a pneumothorax being a collapsed lung, a hydropneumothorax being a collapsed lung due to fluid, hydro. So we never expected it to grow again. And because that's the original source of the tumor, we had no idea if there was even any healthy lung tissue left.
Yeah.
So it's really cool that the right lung is inflating a little, but the pulmonologist doesn't expect it to be a productive lung for me.
And you have a pain pump, you said.
No, I actually evaluated a pain pump and ended up
Okay.
not doing it. I was planning to, but I
Okay.
had mentioned that I lost a lot of weight.
Mhm.
I was too skinny for a pain pump.
Okay.
A pain pump is something that gets installed, well, surgically inserted kind of in your lower abdomen.
Uh-huh.
And then it connects with a little plastic tube directly into your spinal column. And it delivers specifically opioid medications at about 100th the dose of what it takes when you're taking oral opioids.
Okay.
So if you have 15 milligrams of extended release morphine that you take, it would be 100th of that. So
Okay.
0.015.
All right.
So dramatically lower side effects and all of those things. So I was going down that path with a surgeon, and we can't do it when I'm that skinny because it extends out of your body about an inch, and the skin doesn't like to stretch that much. And so it would have caused skin to tear. So I was told I had to gain probably 30 pounds back before I'd be a candidate for a pain pump. Well, based on the time it took for me to regain that weight, I was already feeling so much better. I had drastically reduced the amount of medication I needed to manage pain that it didn't make sense to install a pain pump anymore.
Okay. And do you have discomfort and pain now that's like regular? Like you have some
Yes.
medication? Yeah, okay.
Yes, I do. I call it well managed. So I use medication to manage the pain. And like I said, it's down a lot from what it was. I take a fraction of what I did at the worst of the pain, but I still have medication that I need to take to manage the pain. I then have medication I take to manage the side effects of the pain medication. I have medications that address the side effects of the Tagrisso and so on and so forth. I think it's something like 14 pills a day now.
Do you do how you split them out through the day? You have to do them all early in the day. How do you handle that?
Yeah, it's split between morning and evening.
Okay. When you have pain, what is it? Chest pain? Lung pain? Like inside your cavity pain? What is it?
Yeah, so there's kind of three categories of pain I get. One is inside the lung, and I can't describe that pain to you. Mm-hmm. It's a diffuse, deep ache is the words that I use to describe it, but it doesn't really convey it. Like when your lungs hurt, it feels awful. Yeah. Then I get some lower back and mid back pain that is based on the geometry of my body being changed, especially when I have more pleural effusion. So the right lung, that collapsed lung, mm-hmm. I get drained by a procedure called a thoracentesis. Mm-hmm. It was about every 4 to 6 weeks. Now with the chemo, it's about every 3 months, 2 to 3 months, which is awesome. Yeah. But as I start to fill up with fluid, I get pain throughout basically the whole upper body.
What's the fluid trying to accomplish when it's filling up? What is it doing?
So the body does not like empty space. That is a thing about the human body, and it tends to fill empty space with fluid. That's just the nature of what it does. So because my lung is collapsed, there's a cavity. There's an empty space in the pleura of my body. Again, pleura being the walls of what the lung sits in. Yeah. Since the lung isn't fully expanded and sandwiched against those walls, it creates that void and fluids just seep in there.
Interesting. I'll have to look into the deeper science of why the body is trying to like pressurize the cabin.
So don't know if this one is a little too graphic, but when you draw the fluid out of that pleural cavity, it creates a negative pressure. So thoracentesis uses a vacuum bottle to pull fluid out.
Yeah.
What I end up doing is they turn off to that bottle and then open up a stopcock valve to air, and I reinflate that cavity and put pressure in. They've actually recorded that on video and used it for instruction for medical students because it shows the fluid dynamics. Fluid meaning not just liquid, but also air, the fluid dynamics of the lung. It's really kind of fascinating to see how that works. Yeah. If we didn't do that reinflation, that negative pressure would draw fluids out of the tissues.
Right. And on the quote unquote good side, on your left side, do you have any need for fluid draining over there at all?
So we, as I mentioned, had a Pleurex drain installed on the left lung, and it was in there for a couple of months. And that's where we attach a vacuum bottle to a drain that's installed in me instead of having to poke me each time.
Yeah.
And then that dried up after 3 rounds of chemo. Well, 2-3 rounds ago, we started getting some loculated pleural effusion. And I'll explain the word loculated in a second. But I get some loculated pleural effusion in the left lung now. So I have had 2 thoracentesis of the left lung over the last couple of months. Loculated effusion basically means a pocket has been created or it's fluid where you wouldn't expect. So before, the pleural effusion on the left lung just meant that fluid was accumulating at the bottom of the pleural cavity and was pushing the lung up and up. That's normal. Well, as normal as pleural effusion gets, right? So this time it actually was kind of on the side, and it's almost like the lung hadn't fully sandwiched, which is called pleurodesis. Hadn't gotten full pleurodesis, so we think a little pocket got created.
Yeah.
We're kind of waiting to see if that happens again. We did do a sequencing of both left and right lung pleural effusion, and no malignancy, meaning no cancer, was determined in that cytology study. So the good news is it's not cancer that's causing that fluid. The bad news is we don't know what is.
And all your specialists are right there where you live. Like you don't have to travel or fly to any place to get
that. Is correct. I happen to have a national cancer center in my city, and I've been able to get all of my care through that hospital system. Dramatically simplifies things like imaging and sharing of files, my oncologist talking to my pulmonologist, talking to thoracic surgeons, right? They can all do it within the medical system. I did fly down to Houston to have a second opinion with MD Anderson shortly after my diagnosis. They concurred with my primary oncologist's opinion. And then when I developed that left pleural effusion, my doctor here was able to consult with the doctor in Texas. I couldn't meet that doctor because of state residency and provider licensing, but my doctor could talk to that doctor. And so I've always had that, world-renowned cancer center in my back pocket. It helps out my current oncologist. And if I ever needed clinical trials, if I needed experimental treatments, I now have a patient file at MD Anderson, can always go there as an established patient.
How is your flying, by the way, in current state? Can you fly currently? Well, with all the pressure and the up and down and all that?
Yeah. So it's not actually terribly sensitive to those pressure changes because remember, it's kind of a closed system in your chest. So it doesn't really affect it. It's actually a very common question in our Facebook support groups for the new diagnosed individuals is, what restrictions do I have? And short of comorbidities, again, average lung cancer patient being older and other things, your only illness is exon 19 deletion or other epidermal growth factor receptors. So there's exon 21 and others like that. But as long as your only thing is the lung cancer, you're pretty much fine to travel. Always check with your oncologist, right? The beauty of having cancer is you basically have to run every decision by the oncologist, just in case. But I've had no restrictions on travel and post-diagnosis. I've been to Buenos Aires. I've been to India. I've been to Europe. I've done lots of domestic travel. I'm not traveling as much as I used to. I'm a little more picky about it. And now, of course, timing between chemo, I can't travel on a chemo week, but I'm probably still doing, I stopped with the chemo for a while. So this year is going to be short. I think this year I've only got about 70,000 flight miles under me. So that's a little low for me. The first year of COVID was the lowest I'd ever traveled, and that was about 25,000 miles. The year before COVID, I had traveled 240,000 to give you an idea of what I mean by frequent flyer.
Yeah, that's your gig though. That's what you do for a living.
It's a combination of work and pleasure, actually. So I do also do a lot of leisure travel. And that's kind of a funny thing. Not everyone knows this, but you actually get more radiation from air travel than you do from a chest X-ray.
Interesting. I did not know that.
Yeah, if you go and Google it, you can see the amount of radiation that you get for a domestic flight, for a transpolar flight, for a transoceanic flight. And it's a surprising amount of radiation. And that's actually a hazard for the pilots and the flight crew, the cabin crew. So the flight crew and the cabin crew, that's something that they need to be aware of, their amount of radiation exposure, because they spend so much time high up in the atmosphere with less protection from radiation.
Yeah. So you haven't had any reaction like, boy, because I have stage 4 cancer, I really need to protect my immune system because it's being zapped all the time or being challenged to a high degree all the time. I need to make these kinds of adjustments in how I live and how I do things. You haven't kind of had to really do much of that?
Well, so yes and no. So I should share that I've worked from home for many years, even pre-COVID.
Mm-hmm.
So I don't have the risks of going into an office every day. I probably would consider an ADA accommodation to not go into the office if I had to, simply because I do have periods where my immune system is weaker, even with the maintenance chemo. So in a sense, yes. And I'm a little, as I said, more guarded on when I do business travel now. Part of that also is, at my level, I get to be a little, do I want to take this trip or not? There's some privilege there. But, broadly, I didn't have to change anything because I was already, cautious, right? Traveled less during COVID. Even after COVID, we've masked pretty much every trip. Now, the lung cancer probably made me a little more cautious on that. I don't know that I would have masked, say, for our trip to Europe this spring or this winter if I didn't have lung cancer.
Yeah.
But it doesn't make me not go to events. It doesn't make me not travel. It doesn't, stop me from doing anything I want to. I do think about the event, though. And there are certain events that I will go, that's indoors, that's 20,000 people. Maybe that's not a great decision.
Yeah.
Versus, oh, it's outdoor, it's 12,000 people. Okay, that's probably fine. I can keep my 6 feet.
Right.
So I do have some caution there. And the nature of the chemo cycle is your second week is when your immune system is the most weakened. Right. It just takes that long for the poison to course through the body. Yeah. So week 1, you're okay. Week 2, you're kind of suppressed. Week 3, you come back up. By the end of the 3rd week, you've fully recovered. So then you start over on week 1. When I was on the combination, I did not travel at all because I was in a permanent immunosuppressed state. So my white blood cell counts were too low. Yeah. Also my platelets, also my red blood cell counts. The geometry of my red blood cells, all of it was terrible and tanking. And that's why we stopped after 4 rounds. Initially, we wanted to do 6, but my blood cells said, no, you're stopping at 4.
Do you do any exercise? How do you stay fit or exercise with limited lung capacity?
So the limited lung capacity does present some challenges for exercise. Because my natural resting heart rate is now kind of in the 80s, getting blood oxygen saturation when I need the extra from exercise is kind of challenging. Now, I've never been a power lifter. I've never been a super cardio freak. I've never been one of those. So my general exercise, I can ride my bike. I can do my golf. I can use my hydro machine at home. I just have to be cautious, right? I really need to pay attention to my pulse, and aerobic exercise is challenging for me.
Yeah.
But the good news is I lost all that weight from the chemo. I'm actually at a very, very healthy weight now.
Right.
So it's mostly about, fitness and flexibility, and I can do all of that. Okay. Now, I'm not going to go on a 30-mile bike ride anymore, but a 5-mile bike ride I can do.
Yeah. Could you shoot 18 holes when you golf, or you just keep it to 9? Or?
To be honest, I haven't tried 18 since the chemo. Prior to the chemo, I was doing 18 without any problem.
Yeah. And
I have not honestly golfed this year at all. I haven't even swung the clubs. So I'm probably going to hit some indoor simulators now that it's getting a little cold out there.
How does the cold affect the lungs? Just the same, or is it worse?
Yeah, really no issue for me with weather changes. I will say very hot, humid air does tend to make me feel a little, short of breath, which I'm not. I have a oxygen O2 sat meter that I can put on my finger in case I ever do feel light of breath. It's kind of my, warm fuzzy blanket, as it were, my stuffed animal, whatever it may be. I can plop that on and say, oh, I'm at 95 SpO2. I'm fine, right? Anything in the 90s is good. And I'm consistently above 95. And that was actually the sign that I needed to get that Plerex installed, because I was sitting on my couch and I was at 81 and I hadn't been doing anything for a half hour.
Yeah.
And below 90, there's concerns about your lungs. So that's what ended up, I actually was in the ER for the second time earlier this year. And that's how we ended up getting the Plerex.